I'm ready.
Hi, everybody. This is Dr. Fab Mancini, and I'm so excited because I have here one of my mentors, one of my dear friends, Dr. Dan Murphy. Hi, Dan. How are you?
Hi, Fab. I'm great. Glad to see you.
I'm so excited because every time you and I talk, it seems like we always come up with what it is that most chiropractors out there are really needing. You have been such an influential source in our profession in guiding us not only with the evidence behind the things that we do, but also what are some of the topics that we need to be really up to date with in order to better support our communities. And I just saw that you're going to be speaking on March 15th through the 17th at the Personal Injury Summit. I was one of the past keynote speakers last year. It was an amazing seminar. I know personal injury is still a big foundation in most chiropractic practices, whether they do PIP or whether they do just whiplash injuries from different areas. So I just want to start a little bit about Dan. One of the questions I always wanted to ask you is, you are probably the hardest working chiropractor that I know. And what drives you? Because you have kept this passion for so many years, over 30 years. What is it that drives you every morning?
Well, this is actually year 41 for me, and I'm always excited about the information. I don't like being bored, and I'm totally into the understanding how chiropractic works. I know that it is a combination of orthopedics and neurology, and so that's kind of my thing. And my whole career has been centered around trauma. So I first started with whiplash trauma in 1978. So again, that's 40 plus years ago when I started, and just trying to figure it out. And then right away, I had to testify in a case. And once you testify, you realize, the standards that are required of the practitioners. Well, now I'm up to 33 cases where I've actually had to go to trial on. I've had roughly 15,000 PI cases. 33 actually went to trial. And you kind of learn and you realize that it's not just you, the chiropractor, but all of chiropractic that's essentially part of the trial. So they throw darts at chiropractic, and figuring out how to defend chiropractic and really understanding what chiropractic is and what is defendable, what is more hokey. That's kind of been what I like doing. And I don't know, you say I still have the passion for it. I do. I mean, I really like the job. I think I was born to be a chiropractor, and I like every facet of it. As you just saw Michelle, as she's up there seeing patients right now, we are incredibly busy. We work literally 7 days a week. That I'm doing not only weekend gigs. This last year, I just wrote my Christmas letter. I did 54 different gigs. Besides the practice here and my college class at Life West, I wrote 14 papers. I did a handful of webinars. So I'm really excited about every facet of chiropractic. And when you look at this conference, I've done the conference before myself because I'm into the whiplash thing. And, I don't get to talk for very long. I think it's a 4-hour run. Because I've done a year-long certification program in spine trauma that has graduated over 2,000 chiropractors, and it's 120 hours. I'm going to do 4 hours. So what do I do in 4 hours? And so I just putting my thoughts together, even waiting for this to happen, that I thought the first thing I would do is I'm just going to quickly do some stuff on whiplash terminology. It's stuff that 99% of chiropractors do not know, and yet it is the most important thing. Usually a case is made or lost depending upon the terminology of the practitioner. Well, I'm going to go over just one page on the terminology so that everyone kind of knows and they're in the driver's seat. Then I thought I would do whiplash mechanics. I call it Mechanics 101. Most chiropractors still do not understand that whiplash mechanics drastically changed in 1997, 21 years ago. And so it has a lot of applications to chiropractic. So understanding the mechanics of whiplash, again, just whiplash mechanics 101. Then I thought, we're adjusting people. We're chiropractors. We do what we do. The principles of soft tissue injury and repair. That's always an important thing, and particularly how does the chiropractic adjustment fit into the principles of soft tissue injury and repair? So we'll learn those, we'll go over a few studies, and then we'll just kind of quantify the whole thing. I thought I would do a handful of studies just on neck. There are studies, a lot of chiropractors do not know. There are studies on people that ended up with chronic whiplash. They did not know what to do with them. They're chronic. They've failed all treatment. They referred these people to chiropractors. Chiropractors worked on them, and the outcomes are over 93% effective. These are fabulous studies. So we want to know, what is the chiropractor doing? How does it actually work? So we're going to go over the Adams study, the Woodward study. We're going to go over even brand new studies. You know, this year, 2018, a study came out on neck pain as related to the opiate crisis. It is the most fabulous thing you've ever seen. And by the way, it came out on Mayo Brothers this year, 2018. You look at this, you start thinking, oh my gosh, this is amazing stuff. So I'm going to do a handful of studies like that, which are just the most important things really for chiropractors. And all of this is the most important stuff for chiropractors. And then we're going to go into some adjuncts in treatment. Specifically, besides our chiropractic, I'm going to go over low-level laser therapy. I'm specifically going to talk about lasers for pain management. I'm going to talk about lasers as something that is anti-inflammatory. Because when you're board certified in orthopedics, I am, you can sum up orthopedic education in a sentence. And the sentence is, the resolution of inflammation is fibrosis or scar tissue. When we see someone in a whiplash 9 months after an accident, we are not treating sprains and strains. We're treating the body's response to sprains and strains. It's called the fibrosis of repair. All of that is subsequent to inflammation. The resolution of inflammation is fibrosis. So if we can be effective in treating inflammation, we can reduce scar and therefore reduce subluxation and the neurological and the orthopedic components of the subluxation. So we're going to use lasers as not only a pain control, but also as an inflammatory control, so we have less scar tissue. Then we're going to use also lasers to accelerate healing. We will look at studies from the best places that if you know how to use a laser, and I'm going to show people a protocol, that the laser can take almost any soft tissue injury and cut the healing in half. So if you have a 6-week problem, you can cut it down to a 3-week problem. So that's kind of what we're going to do. And then chronic whiplash. We'll look at studies on chronic whiplash. What are the common denominators in chronic whiplash? It's scar tissue. This has been histologically proven. We will look at those studies, and then we will look at studies on how lasers can degrade scar. Because a lot of times, chiropractic is a last choice for people. They go to everywhere, and they get so desperate, they'll come and say, I don't even know I'm here. I've been everywhere else. I don't know why I came in here, but I'm desperate. I don't know where else to go. So we quickly go to work on them, and people right away start to feel better. What are we doing? In part, we're breaking down some of that fibrotic glue, improving movement, which creates a neurological sequence of events that closes the pain gate. And my goal, of course, is to just sort of put that all into a 4-hour presentation. It will be the best stuff. I mean, there's no doubt. It will be the best stuff. Again, just the frustration of not doing more than that, but it'll be the best stuff. And then it should dovetail in great with the other presenters, the other speakers. And because you just look at the economics of it all, everyone has to have car insurance. It's the law. And consequently, it's one of those things where there's no deductibles, there's no caps, that chiropractors can do what they do best and get appropriately reimbursed for it. And that's a big deal in this day and age. And so we don't do much other than PI and cash these days, because everyone else has really high deductibles. And this is just, we kind of sidestep ourselves from that and just kind of go at it. But if you're going to do PI, you have to know some stuff, because they're going to ask you. And they're going to ask you either in a report, a deposition, rarely a jury trial. But you have to know stuff so that you don't embarrass yourself and you don't embarrass the chiropractic profession. That's my goal. That's my job with this conference. I'm pretty good at run-on sentences, aren't I? You start it, and then I just kind of went, like that. So.
Well, you know, what I love about you is the fact that every time, and I told you this, especially when I introduced you in some of the events, every time that I attend any of your classes, I always walk out of that class with a higher level of certainty. And over the years, over the last 30 years that I've been in this profession and I've been looking at what works, what doesn't work, I realized that the foundation for success is your level of certainty. And it doesn't matter how you choose to practice, you got to really understand your stuff and be the best at it. What I love about your classes is always that you concise the information in order to be digestible, in order for me to get it. And I'm not as bright as you are and as many other chiropractors are. So I needed to simplify it. I needed to be practical. But then at the same time, you give me the foundation of evidence. And as you know, today's world, one of the things that I've been a big proponent of since I've been in this profession is you got to back up what you say. We can no longer take chances out there because our credibility in the marketplace has suffered a great deal over the years. And because I'm out there doing TV and radio and constantly being challenged by some of these hosts and saying, well, chiropractic doesn't work, or you're not a real doctor, I have a high level of certainty, so I know how to respond to that. But I want every chiropractor to be able to benefit. And I do feel that PI is still underutilized in this profession because many times chiropractors have left it thinking that it's only about dealing with attorneys and I don't want to cut my bills. But in this conference, what I learned by speakers like you is that PI has tremendous amount of science, protocols, technology that is supportive, like you mentioned with low-level laser, but also the fact that the public demand to see a chiropractor for PI is still incredibly high. So I love the fact that you're going to be putting in there all that information, concising it, giving us the evidence. But if you were to say to a chiropractor out there that is wanting to do PI but doesn't know how, or is doing PI but feels a little bit uncertain, why is it that they must attend this conference? Because I was blown away when I attended last year. I never seen so much information regarding one topic, which is personal injury, and how chiropractic is the foundation and how to resolve most of those challenges for those patients.
Well, you said it pretty much exactly right on, and that is, if you're going to do PI, you have to have certainty. You have to know stuff, and that's the whole goal behind this. Again, my stuff, in my 4 hours, again, is going to be terminology, soft tissue injury repair, basic mechanics, because mechanics is a big deal. Once you understand that, in fact, I'm going to put most of it onto a single page and saying, okay, this is the whole thing on Whiplash right here. Let's just start with a very basic question. What tissue is the primary tissue responsible for pain, acute and chronic pain following whiplash? They've known since 1993 it's one tissue. What tissue is it? Well, guess what? It's the exact tissue that chiropractors use when they adjust people. So we're influencing. So chiropractic is natural for the whiplash phenomena. Exactly what the pathology is exactly what we are managing, which is why we do, in fact, get great outcomes. We will look at some of the studies on outcomes. Now, how many people know that just a couple years ago there was a study where they looked at a bunch of people that had neck problems, and they realized that 89% after they got treated chiropractically had a long-term stable therapeutic benefit. Only 11% had recurrences. We get great outcomes on these people. We'll look at those studies, and again, it's designed to give you certainty. The other thing, just the presentation, when you look at the people that will be there, they're all enthusiastic. I remember a few years ago at Parker, which you know so well, that they brought up a bunch of the old timers. And these guys were really old. I mean, they had trouble even getting up on the stage. They're so old. And they gave a talk, and I sat there and I took notes, which I shared with my college class at Life West. What was the central theme, the common denominator between all these diverse old timers? And it was levels of enthusiasm. They're just so excited about the job, about what they do. And I still think that one of the greatest facets of success on anything is levels of enthusiasm. Not only will we present great information in terms of increasing certainty, the whole process, the speakers, the whole thing, the way it's put together is incredible enthusiasm, which is kind of infectious. It's really, it's fun to be around, which you don't need to hear at all because you're kind of the leader of that. But that's the other part. We're doing certainty and enthusiasm.
Well, what I love is many years ago, Dr. Parker taught me a formula that I followed all my life, and that is your thoughts, your knowledge leads to your actions. Your actions is what we do with that knowledge, which you always give us great protocols, great understanding, what to do, because most of us, unfortunately, don't know how to apply sometimes the knowledge that we get from individuals like you. But then you give us that knowledge then gives us outcomes, right? We get results. When we get results, it's very easy to be enthusiastic. I've always been very passionate about chiropractic because I focus on the results that we get on patients. I don't get 80% or 90% of my time focused on the challenges that we face in our profession internally and externally. What I focus on is the outcomes that we're getting on people's lives, millions of lives every single year. And because I focus on that, it's very easy for me to stay up, to stay passionate, to stay relevant. And all I kept thinking to myself is, how can I bring this information to more people? And that's what kind of led me to where I am today. But let's close with this. You are extremely disciplined. What are some of your behaviors that have allowed you to be so successful for so many years, over 40 years in being in this run, and you have been one of the most influential individuals in our profession? To me, you're a living legend, and I hope you're going to last 30, 40 more years teaching us because you are so good at this. But what are some of the 2 or 3 or 4 behaviors that you do on a daily basis that you feel has allowed you to be this level of success and influence in our profession?
Well, just recently, the Wall Street Journal, the best thing I read a lot. I read 5 newspapers a day. I read everything. One of the things I read is the Wall Street Journal. And the best thing I read every week is the Saturday review of the Wall Street Journal. It has the best information. It's non-political. It's just the best information. And just recently, there was one on leadership, and they profiled George Washington. And the author pretty much says, using George Washington, is that there's only really 2 qualities for leadership, and I'll do one of the 2. The one was lead by example. And so he was always on the front lines himself, lead by example. So we've run our lives by example. I mean, everything we say, we're not hypocrites. We're not too hypocritical. We're very, we live it exactly the way we preach it. We're under chiropractic care. We get up early. We don't watch television. We eat healthy, and we exercise literally every day. In other words, we try to represent the best of what we preach. It's the chiropractic innate lifestyle. We live the innate lifestyle, and that's the most important thing we do. And I think that some of our successes are because of that. We're living the example. We're showing the example, leading by example, and I think that's made the biggest difference in our lives. I mean, even today, Michelle is so busy. She actually starts seeing patients now at 5:30 a.m. I mean, imagine that. That's the only time she has an open slot. So it starts 5:30 a.m. But every day, even today, I notice she gets up in the middle of the night practically and goes to the club and works out every single day. We do everything right. Our diets are impeccable. We have no crappy carbs. We have nothing but the best of food. Everything is organic. We actually, again, lead by example, which I think is the most important of all the things that we do. And one of the reasons that we're well known, and I think people kind of they ping me. They say, yeah, it's we're following your lead kind of thing. So
well, I know that in order to be a successful communicator, you must leave your message, and you have definitely done that for all these years. And I just want to say personally, thank you for all the support, all the knowledge, all the mentoring, all the wisdom that you impart in all of us. And thank you for continuing to look at all the evidence and research out there and putting it together in a way that we can function, we can utilize it, we can actually know what to do. on a daily basis. I'm looking forward to this event. I know you're going to be amazing. And I just want to thank you, Dan, so much for all you do for our profession, for us individually. And I hope that I can't wait to see you real soon, and we can hang out together.
Yeah, I hear you. And thanks for all the kind words. I'm glad to see you.
Thank you, brother. I'll see you soon. And you guys that are watching, I hope that you make a decision right now. I'm going to put the link right here where you can join us for this Whiplash Personal Injury Summit. Is probably the best personal injury event in the profession. You don't want to miss it. And come and hear really how to build that certainty. And most importantly, come and experience someone that is so great like Dr. Dan Murphy, so you can walk out of there with his level of certainty and be able to serve your community with chiropractic care in a greater level. So God bless you, Dan. I'll see you soon. Thanks, everyone.
I'll see you soon. Bye, everyone.